Good afternoon, good morning, wherever you are watching it from. Here in US is almost 1 p.m. I know in Africa is already evening. So with me today, I have Dr. Judy Kimatu and I have Chief Engineer, Pilot, and Daniel. So today we'll be talking about different topics. We'll be talking about mental health and depression because there's a lot to learn. And Dr. Judy has a lot of knowledge and wisdom and a lot of experience handling those kind of cases. So we'll start with the introduction from Dr. Judy, and then we go to Chief Pilot Daniel, and then we go on deeper into the topic. So welcome.
Good afternoon. In Kenya, good evening. Good night, actually. My name is Dr. Judy. Like I said before, Dr. Moeni. I'm a healthcare provider, and I am here to talk about mental health. From my last post, I had a lot of people request topic on mental health. And mental health is a diverse topic with a lot of diagnoses in there. We have depression, we have dysthymia, we have bipolar, schizophrenia, and so forth and so forth. So many diagnoses right there. Personally, I have treated a bunch of people with mental health issues. And what is mental health? Like I said, it can vary in so many ways. But basically, what's happening is like you have chemical imbalance in the brain, and a lot of people it's runs in the family. You find like the mom, dad, one of them has it, and some child or two have it, and so it can run in the families. Or it can be trauma induced. Some happen to you, and you get what we call episodic type depression. So it's a lot. The only problem is that it is so much, it's not discussed. I brought two walls here at the table. I brought an African to tell us more about the perceptions of mental health in Africa, and also brought an American to tell us what the mental health knowledge is in America. So, again, we're here to talk about mental health, which is a real topic. A lot of people struggle with mental health, but they don't talk about it. And why? What is the reason don't people talk about mental health in Africa?
I would say the topic itself, mental health, most people don't recognize that they have a mental issue. And especially where we come from in Africa, for somebody to be diagnosed that they have a mental issue, they believe that you have to go to hospital so that you can be diagnosed. But there are so many people who doesn't know that they have mental issue by the way their lifestyle, the way they handle things. So mental health, it's broadened, you know, and for many people to recognize that they have mental issue, it will take time to have a personal self-evaluation, you know, because like we have hospitals of mental people in Africa. So we believe, and that's the perception we have, we believe that the only people who have mental issues are the one who go to those hospitals.
And that's not true, because we here can have mental health issues and nobody knows about it. That is the scary part about it. It is so personal, and a lot of people struggle internally without saying that they struggle with mental health. And so, what are some of the symptoms of mental health? A lot of young people be substance use disorder, alcoholism, and then we just think that they just they smoke weed or they like to drink and just label them as alcoholics. And once they know they are labeled like that, especially in Africa, they just get worse and they just never come back.
If I may ask you, sorry to disturb, but if I may ask you, is mental genetic?
Yes, it can be. It can be. Mental health is genetic.
So there are two things that influence in mental health. It can be either substance or drug abuse or genetic.
Correct. It can be like trauma induced, like you went a post-traumatic stress disorder or some childhood trauma,
like PTSD.
or yeah, it can be induced by different experiences. And so some people are very vulnerable, and it can just happen like that. But some people are more resilient. It can take a lot. It's just like stress. Stress is a mental health. And so most of the depression starts with little stress, and then it progresses to anxiety, and then it progresses to depression, and it just becomes major depression. And so if the stress management is not good, it can enter the the extreme part of it.
Alright.
And so, yeah, I do know in Africa there is a lot of work to be done about mental health. I do remember people just walking with mental health issues, walking in the streets, and people making fun of them and talking about them, and just there was no care for mental health issues. But here in America, we'll go ahead and get the perception of mental health from none other than Daniel. He was referred
Chief
as
Pylon.
Chief Pilot and the engineer. So tell us, what is the perception of mental health in America?
Well, for a long time there was a lot of stigma around mental health that you don't want to associate with people with mental health problems and stuff like that, and that has been reduced significantly in the last couple of decades. It's a lot better understood now. Seriously, all of us have some type of mental health issue. Whether it's anxiety about taking a test or something like that. These are all very mild forms of mental health issues, but and then there are the more serious, like the major depression and so on. And unfortunately, in many areas of the country, they don't have really good mental health treatment as far as like centers and stuff like that. It's not always easy to find out how to go about getting treatment or diagnosis and treatment for mental health. But it's
Unfortunately, here in America, there is a lot of push for mental wellness. Even in churches, it's starting to push its way in the church. I give an example. Our church is building a big mental health facility to help people with mental health cases. So we're getting somewhere. But one thing I'll tell you is, like, mental health is really, really, really rampant in every family. Families are struggling a lot with mental health, and I'll tell you, do not feel like you're just alone struggling with this, and you are not a stigma. You just know that there is help that you can seek. Okay, if you don't have a support system in your community, there is a therapist that can help. People can get help from psychiatrists or psychologists. Those are the therapists I was referring to. And also you can just, hobbies tend to help. Exercise is also really good to deal with mental health issues. And just self-love. You just have to love yourself. Another thing I will tell people is a way to cope with mental health. Not everybody that's posting on social media is doing as good as they seem to portray. Right. It is such a not right way to portray how you're doing, because we post things in front of our big old houses, in front of our big cars, in front of our big everything, big place, big our Sunday best. But that's not how we live. Everybody has a downtime where they're themselves. So we need to stop copying and looking at people and thinking, they look good, and you start comparing yourself with other people. So just love yourself and don't feel bad when social media has a lot of people who seem to be doing good because it's a front. Most of it can be, not everybody, it can be a front. And social media can be a tool to cause a lot of mental health issues. As far as comparing yourself, and you had a point.
Yeah, I actually had a question. You mentioned two different types of therapists, psychiatrists and psychologists. Can you tell us what the difference between the two is?
Psychologists, they do treatment modalities whereby they do counseling. They have some different approaches to helping you with your mental health. Psychiatrists can prescribe medication and treatment therapies and some high tech treatment modalities that are out there, at least here in America.
Okay.
All right. I think
In
now,
Africa, how is the treatment?
for the treatment of mental health in Africa, it's I've never heard of anybody with mental health going to therapist. All I hear, they have gone to mental hospital. So I believe this is a very, 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 very important topic. So we're going to take a short break, and we will be back to talk more about depression and self-love and how the social media is impacting us, negative and positive, and what we can do better.
Thank you.
Okay.
Stay tuned and see you in a few.
Okay.